I'm Caitlin Tivnan with your latest Health Watch News Report, presented by UMass Memorial Healthcare. I'm here with Dr. Robert Phillips today to talk about one of the most preventable yet most common causes of heart attack and stroke, high blood pressure. Dr. Phillips, can you tell me a little bit about high blood pressure and why it is so important for people to be monitoring their blood pressure on a regular basis?
High blood pressure is elevated pressure in the blood vessels, and that can lead to heart attack, stroke, and kidney disease. It actually is the most common reason around the world why people have these conditions, and it's very preventable.
What are some ways that you can prevent having high blood pressure?
To exercise more is to try to keep weight down, and if you can, to reduce the sodium in your diet.
Is there one demographic that has a higher risk of having high blood pressure than others?
African Americans have higher risk, around 50% higher risk of having high blood pressure.
Is it an age or is it a weight? Is there other factors that you think contribute to high blood pressure?
As we age, just about everybody has an elevation in blood pressure. That's because the arteries don't stay as flexible as we age. They get a little stiffer. So just about everybody, as they get older, the blood pressure rises.
How often should someone be taking their blood pressure? Is it an annual thing? Should you wait till you go to the doctor for your yearly checkup, or should you do it more often?
I think that most people can actually get their blood pressure checked when they see their physician or their care provider. If it tends to be a little elevated at that point, then they can get into a routine of taking their blood pressure more often at home.
Once, say, you do recognize that you have high blood pressure, what are some things you should do?
The simplest thing to do, and works very effectively, is to start taking one of the medications which we have for high blood pressure. There are many different types that you can take. They're all very effective, and usually most people require 2 medications to get the blood pressure to a normal level.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.